And more local news, experts are saying the newly signed federal budget law signed by President Trump on July 4th is threatening the health, food security, and stability of families across the state. 41 NBC's Brianna Sheffield has more.
Director of Health Justice and Georgia Budget and Policy Institute, Leah Chan, says health care provisions in the bill threaten the health and economic security of Georgia's low-income families.
We are likely to see reductions in access to healthcare coverage, pressure on household financial security for lower-income Georgians, and greater risk of medical debt, financial strain on safety net healthcare providers, and increased risk of hospital closures, particularly in rural areas, and stress on our state and local economy with job losses and reduced economic output.
She says modeling shows 4 hospitals are at risk of closing. They're in Macon, Washington, Fannin, and Erie counties.
So a closure in one of those counties doesn't just impact the folks who are on Medicaid. It impacts the privately insured older adult who has been seen in the ER when his diabetes symptoms flare up. It impacts the charge nurse who's worked at that hospital for over 20 years. And it impacts the cafe next door that stays open thanks to business from hospital patrons.
According to Senior Health Policy Manager for Georgia Early Education Alliance, Callan Wells, says this bill has reaching implications for children.
Children rely on the adults around them, parents, teachers, neighbors, extended family, to keep them safe, healthy, and fed. While the bill may exempt parents of young children from work requirements, it does not shield the broader network of caregivers who help raise them. In other words, when adults lose access to healthcare or nutrition support, children also experience that loss.
I spoke with Executive Director of Macon Volunteer Clinic, John McCard, about how they're preparing for these new changes.
We've always been available to people who work but are uninsured. And if people are going to lose their benefits due to the cuts that have been made from the bill, we'll be certainly welcoming them here, assuming they satisfy our income requirements and meet the criteria we normally have for our patients.
The clinic offers primary health care, eye care, dental care, and some mental health counsel too. But McCard says in order to qualify for those resources, you can't have any insurance.
We never charge anyone for any of the health care here. So all the services we offer, including some pharmacy and medication, is free.
And McCard says if you are in need of medical care, everything at the Macon Volunteer Clinic is free. So please do not hesitate to visit. In Macon, Brianna Sheffield, 41 NBC News.
Director of Health Policy and Georgians for a Healthy Future, Whitney Griggs, says the cuts to Medicaid, Affordable Care Act access, and SNAP benefits will leave hundreds of thousands of Georgians without health coverage or food assistance. So she recommends finding solutions now.